This community health assessment looks at my hometown, Factoryville, PA. Factoryville is a small rural town located in northeastern Pennsylvania. It started as a farming and factory center for residents in the 1800s. On top of the factory and farms, it used to have 7 stores, 2 hotels, and 3 physicians. The town was also known for a member of the Baseball Hall of Fame. Christy Mathewson was born and raised in Factoryville in the early 1900s. He was one of the first members to attend Keystone Academy, which later became Keystone College, now located in La Plume Township. By walking through town, there can be many tributes seen to him today. Factoryville is considered 99% urban and only 1% rural. This can be attributed to the fact that the majority of town, which is only 3/4 of a square mile, is made up of houses that are located very close to one another. There's an abundance of family-run businesses seen throughout the town. There are no stores, however, so this could make it more difficult for people to get supplies that they may need. On the outskirts of town, there are a large number of wooded and grassy fields. You may also see individuals playing outside with their families and children. This can be seen either in people's own yards, on the playground, at the baseball field, or on the new bike trail that was just built within the last year. Because of outdoor activities, this puts people of this community at a higher risk for Lyme disease. Not only are the individuals on the outskirts of town at risk, but so are those that are located in town. It is not uncommon to see wildlife walking throughout someone's driveway or crossing the street in town. This can bring the tick population anywhere that they would find a suitable living condition. According to the PA Department of Health, there were over 140 cases of Lyme disease for every 100,000 people in Wyoming County during 2016. Lyme disease is an infection of the bacteria Borrelia burgdorferi. This is mainly transmitted by deer ticks. When the tick bites and buries its head into the skin, it expels this bacteria into the bloodstream of its host. This disease is seen nationwide, but is more common in densely wooded states. Pennsylvania has the highest morbidity rate out of all of the states, with over 7,000 cases a year. This number is calculated by the amount of individuals who are hospitalized for symptoms and are reported to the state. Symptoms can range from mild to severe. Mild symptoms include rash, arthritis, and fatigue, but can progress to fever, neurological symptoms, or endocarditis. Even though these symptoms can progress to severe, they only rarely have been reported to be the single cause of death. There are multiple ways to prevent contracting Lyme disease. The first is through primary prevention, which aims at not allowing the infection to come near the body. This type of prevention can be achieved through educating the patient on what they can do and making sure it's implemented. One of these things includes wearing protective clothing. Individuals who are walking around in high tick population areas should wear boots and high socks with their jeans tucked into the socks. Another preventive measure is for the individual to wear tick-repelling bug spray. Finally, tick populations like to live in mulch or leaf piles. Individuals should remove these from yards if it's not necessary. Secondary prevention aims to prevent the disease from spreading any further if the individual was exposed. This would include screening. When an individual returns from being outside in these high-risk areas, they should screen themselves or have someone else check them for ticks. When ticks first attach themselves to the body, they are very minuscule and black, which can make them hard to find. Ticks like to find areas that are warm and dark, so you should check the groin, armpits, and hair. This doesn't exclude other body parts, however, so a scan of the rest of the body is necessary. Tertiary prevention works with patients who have contracted the disease in order to get them back to or as close to their baseline. An individual who is bitten by the tick should remove it by the head. If the head breaks off under the skin or the tick has already implanted the bacteria, the individual may see a bullseye rash around the area of the bite. They should observe for any flu-like symptoms and report to the hospital for treatment. Many hospitals may treat individuals prophylactically by giving them antibiotics and steroids to decrease the effects, while others may wait for symptoms to appear. Factoryville has few barriers to receiving the proper care needed if an individual contracts the disease. The rurality of the town is the main issue with getting available help. Because of this, there's no public transportation available, and the closest bus stop is 3 miles away. Like earlier discussed, there are no stores in town, so individuals without cars may not be able to get bug spray or longer pants. There are also no healthcare facilities in town. The closest primary care office is located in Nicholson, which is 6 miles from town. The closest hospital is located in Tunkhannock, which is located 14 miles away. Again, this may be a problem for individuals who do not have access to vehicles. The poverty level may also influence the type of prevention these people partake in or the care they receive. In an interview with the secretary of the elementary school, she said that over 40% of students in the school qualify for free or reduced lunch, which means their family falls around or below the poverty line. While doing research, there were a few articles I found that could be useful in promoting prevention of the disease. In the first study, researchers considered the efficiency of a vaccine for Lyme disease. Many individuals do not approve of vaccines because of the possibility of adverse effects. In 1998, researchers developed a vaccine called LYMErix. This was later discontinued because of the drug creating problems with arthritis. Researchers ask individuals their knowledge on Lyme disease, what they can do to prevent it, and if they believe vaccines can be effective. They found individuals in the study did not use basic preventive measures such as checking for ticks after being outdoors, wearing long pants tucked into socks, or wearing repellent spray. In a nursing practice, it would be very important to educate patients on benefits of the vaccine. The vaccine could prevent the incidence rate of Lyme disease increasing and possibly decrease the amount present now. Another educational point that could influence the rate of compliance with this vaccine would be to inform the patients receiving it of the possible side effects and why the drug is better than the one that was created before. This vaccine could prove to be very useful if it were passed by the FDA for use in the United States. It could be used as a primary prevention technique to inhibit the disease before there is a threat. Another topic that would be important to educate people on would be the prevention techniques. In this study, a majority of individuals did not participate in preventive measures. Using these techniques after possible exposure or before exposure may not be implemented because of their lack of knowledge on the disease process. Finally, individuals would have to be proactive and seek treatment or use these implementations themselves. In the next interesting study, researchers dig through Lyme disease cases up to 8 years back to look at the form of diagnostic tests used and treatment types. Treatment measures included prophylactic use of antibiotics. Of the people that were found to be bitten by ticks infected with the bacteria, but were asymptomatic during assessment, around 40% were treated prophylactically. The study also found that blood serum tests looking for antibodies of the disease were mostly ordered within 18 days of the tick being removed. It is recommended, though, that to receive treatment, the tick should be removed and treatment should be started within 72 hours. There are a few things that nurses and healthcare institutes can learn from this article. Healthcare facilities can work to improve the rate of people they treat prophylactically. With only 40% of the asymptomatic group receiving prophylactic therapy, this could be a reason for the increase of prevalence of the disease. Another finding from the study that can be implemented into patient care would be using blood work to determine the presence of bacteria in a potential human host. This is important for determining the level of care the patient receives. It is also crucial that the test for blood work be completed in a timely manner to be able to catch the disease early and treat. For this to be able to occur, however, nurses need to provide the proper education to patients that if they are bit by a tick, they should report to the healthcare center to be treated. Another educational aspect of the study would be to instruct patients how to properly remove a tick themselves. Many people often remove the tick without removing the head, which can still transmit the disease. Researchers should also survey different areas for disease prevalence to give better insight to individuals of the community so they can better protect themselves. Another study focusing on Lyme disease looked at environmental risk factors in hopes that they could prevent the spread of the disease. Researchers used Minnesota State for this study and surveyed the land layout and number of cases. It was reported that over a 16-year time frame, the cases of Lyme disease grew over 700% and spread throughout the entire state. Attention was first put on the fact that there could be a large population of animal hosts who carry the ticks in this area. Research also found that the disease was not only contained to the rural areas of the state, but also could be seen in urban areas. They concluded that the increase of tick-borne diseases can be linked with the number of deciduous forests and the temperature being above freezing for an extended period of time. This can be used in public health nursing to educate people of the community. Since there is not anything that can be done to change these factors that increase the risk of Lyme disease, it is important for individuals to be educated on how they can protect themselves from the disease. Another educational piece would be to make the environment safer. If individuals are bitten by a tick that could possibly carry the bacteria, they should be aware of treatment options and where those options are available to them. Nurses can have an educational meeting on disease if it is prevalent in their area to address this. Another important aspect that was evaluated in this study is a survey. Researchers should look into other areas or states that have a high rate of Lyme disease and compare it to one another. This would be helpful in determining if all states share similar risk factors. The 3 websites and sources that I found most helpful during this assessment were the Pennsylvania Department of Health, Occupational Safety and Health Administration, and the Center for Disease Control. These sources provide plenty of valuable information that nurses can use to educate their patients in preventing Lyme disease. Factoryville is a small community with a strong background. Families are seen playing outside with their children often, which puts them at high risk for Lyme disease because of the wooded and grassy areas in the community. This can be seen because of the high report rates in Wyoming County. The nurse should educate community members on preventive measures such as protective clothing, bug spray, and screening, and what they can do if they experience symptoms of the disease. The nursing practice also uses studies to better implement care, such as vaccines, early diagnosis, and how to create a surveillance of the area. If anyone is interested in seeing an aerial view of the town, please follow the link on this slide.